Good evening, everyone. Thank you so much for joining us this evening for our panel, the Ladies of Hope Ministries, during World Doula Week for Empowering Birth Work for Justice Impacted Women. I am Topeka K. Sam, the founder and executive director of the Ladies of Hope Ministries, whose epic vision is to end poverty and incarceration of women and girls globally. I truly, again, am honored to be joined by this incredible panel of birth workers who are empowering birth work for justice impacted women. And so, without further ado, I'm just going to go ahead and get us started today by introducing our panelists. First, we have Jenny Joseph, who is the founder and president of Common Sense Childbirth, and she is a creator of the JJ Way, a common sense approach designed for women and children, and is on the forefront of a shift to invest in studying and addressing racial disparities in maternal care, and is one of the world's most respected midwives and authorities on women's health, healthy pregnancies, healthy deliveries, and healthy babies, and was one of Time's Women of the Year in 2022. Yes, congratulations on that. I saw that the other day. I was like, okay, get it, girl. Jenny is the first Black person in the US to privately own a nationally accredited midwifery school where she is increasing the ranks of Black midwives, training other health workers around the country in midwifery principles, and developing a national network of like minded providers. She's a true advocate for systemic reform that puts women and babies first in healthcare before profit, convenience, and the numerous reasons America trails other developed nations in healthy births. Thank you so much for spending time with us this evening and for all the work that you've been doing with us at the LOHL.
Thank you so much. I'm glad to be here.
Thank you. Our second panelist is Akmari Sakara, has been a childbirth attendant for over 30 years and is the Chief Family Development Officer, Health Systems Navigator with the Cultural Wellness Center, where she supports individuals who are interacting with the healthcare system. In September 2014, she received another certification to be a perinatal education trainer for the Common Sense Childbirth School of Midwifery. She sits on the board for Everyday Miracles, a doula service in the Twin Cities of Minneapolis, St. Paul, and for the Minnesota Breastfeeding Coalition, and is a co-chair for Integrated Care for High-Risk Pregnancies. Welcome, Akmari, and again, so happy to see you and
Thank
have
you.
you here. Thank you. And Halima Washington, who is an advocate and activist and advocate, a human service professional with nearly 2 decades of experience working to build power for impacted communities in New York City and beyond. Halima is also a Black mama and doula committed to creating a world where Black mothers, children, and families can be safe, seen, and supported. As the community coordinator and leader of the PAR project at RISE, Halima currently leads a team of impacted parents in holding community conversations and conducting community led research to identify and develop a vision to address root causes and offer solutions to child welfare involvement. Excuse me. Prior to joining RISE, Halima worked as a facilitator for the Beyond the Bars Fellowship Program at Columbia University's Center for Justice. Halima is a former Columbia University Beyond the Bars Fellow and New York City Department of Health Birth Justice Defender. Welcome, and my sister. Welcome, Halima. So happy to see you again. And this is an incredible panel. I thank you all again for being here. And I always read a word that is sent to me in a bio. And I know this was condensed, this was short, because these women are powerhouses, not only in their respective fields, but in the world, right? Black births, Black maternal health now is being something that is widely spoken about. However, it is something that has always existed. And unfortunately, the death rates, which I know these experts are going to share a lot of the data that surrounds that, but we often have not spoke about Black women or women who are presently incarcerated, and what that's like having births while in prison. So thank you again, ladies, for working alongside the Ladies of Hope Ministries to provide this opportunity, not only for women who are presently or previously incarcerated, but now going to be able to launch our first cohort with you all for women who are presently incarcerated in prisons and jails around the world. More to come on that. You know, I'm always working behind the scenes. Y'all don't know about all of that yet, but I thought I'd put it out for everyone. Tanja Hanzi, who is behind the scenes right now, but is also the director of health equity. Want to give her a big shout out, who bought Common Sense to us as an organization and felt that it was necessary that as we build and scale this program globally, that we have the best of the best. And so I'm really, really excited. And thank you, Tanja, who will be also working the chat. So anyone who have any questions, please make sure you put them in there for when we do the Q&A. And so just to get everything started, I'll start with you, Jeannie. In 2009, you founded Common Sense Childbirth School of Midwifery, where the mission is to inspire change in maternal child health care systems to re empower the birthing mother, father, family, and community by supporting the providers and practitioners and agencies that are charged with their care. So, in your career, can you talk to us about the systemic racism and how you have seen that play out in maternal health care in this country?
Yes, I can. And I'm glad to have that topic to begin because that is what permeates everything that is wrong with these egregious and shameful outcomes that continue decade after decade. You're absolutely right, Topeka. This is not new. And yes, we've had our little moments where we have a flurry of interest in talking about and bringing awareness. We fall back and then we go again. That is the systemic racism that underlies all of our hard work and thwarts our purposes. When this system that we look at, which I call the maternal toxicity, in other words, I feel like we have areas, we have institutions, we even have virtual spaces where it's just not safe to be pregnant or parenting, especially if you are Black, African American, African descent, Native, Indigenous, or of color. Those areas, those ways of being, those systems, those institutions are so deeply racialized that we are suffering those outcomes based on that and that alone. Much of these outcomes are preventable. 3 to 4 times as many Black women dying during childbirth or pregnancy. Unreal and outrageous. No excuse whatsoever because it's not about our physiology. It's not about our race, our color, our ethnicity. It's about the
That's right.
system. And so
Mhm.
the racism that permeates all of our systems impact all of our childbearing folk and their families continually and have undermined our ability to function and be free, be safe, and receive respectful care, quality care. And we are now at the point where we recognize that we must talk about all these systems, all of these complexes, including the prison industrial complex, right? We have the medical industrial complex. We have the nonprofit industrial complex. We have I mean, I could go on and I won't, but
That's
that's
right.
my answer. It is in everything and it is everywhere. And although that's very overwhelming to hear, that's how we fight. We must face that if we're going to make a difference.
That is such a powerful point, and I love how you framed all of the institutions and these complexes, right, that we deal with. You know, when I think about the nonprofit industrial complex, being, you know, a nonprofit CEO, and as a Black woman who's been previously incarcerated, how difficult it is for us to be able to raise funds to do the
Mhm.
work that we know innately needs to be done. And the fact that there are so many biases, right? That people who say that they want to help to support the work that we do, yet they only want to give a certain amount of money because they're really scared that we might do something quote criminal, right? That we cannot have rehabilitated or changed our lives, or will decide to look at us a particular way when who we may have even been in the past. For example, like my charge was a drug conspiracy charge where it was about selling drugs. But why would I then be looked at as someone who would steal money? Because that wasn't what I was even, that was never even, you know, my past. And so,
Mhm.
you know, I'm grateful for corporations like Optum and United Healthcare that actually have invested in
Yes.
this program for us to be able to do this work and continue to grow to scale. And you believe, as you mentioned, in equity or equitable maternity care, right? And that all people deserve a healthy pregnancy, birth, and baby. So no one has ever been or can ever be turned away,
Right.
regardless of the ability to pay, and focus on the safety, quality, and workforce development in maternity health care, right? Like,
Yes.
again, speaking just to my own prison experience, I remember meeting a sister who was pregnant while we were inside. And I just couldn't understand for the life of me why she was in prison. And then having visited prisons around this world and seeing women and mothers, and I'm like,
Hmm.
wait a minute. If you feel that a woman is safe enough to be with her child in prison, then she is safe enough to be with her child at home. There's no need to bring a child into those conditions where we're trying to decarcerate anyway. But
Yes.
then to bring a baby into these cement cages, right, where you have a child now that is developing their little lungs and their body, like how is that impacting them at childbirth, right?
Right.
And so just talking and thinking, as we keeping the theme on that population, can you tell us more about your work with the National Perinatal Task Force and
Yes.
the work being done to change the worsening maternal child health outcomes in the US?
Well, it comes back down to these four basic tenets, and we have this throughout all of our programs, including the National Perinatal Task Force. Those are access, connections, knowledge, and empowerment. The access piece is key. So that's why it's simpler if we just don't turn anyone away, because that means no one has a barrier, right? So we do work with people who are formerly incarcerated in their pregnancy, they get let free, and then they cannot find a provider. Why? Racism, classism, sexism, isms, right? They can't get started with prenatal care, yet they are as deserving as everybody else to have solid support, safe outcomes, and their human rights protected, right? So we
Mhm.
found that the simplest way is everybody's welcome. We'll sort it out when you get here. We'll do the triage part after you get in the door so that we can get you to the right place, the right resources, the right support. That has held us really strongly. And we've been able to do that not only for the clients, for the patients and their families, but for the providers. Providers have the same drama. We have all of these different silos and categories and credentials, and there's the drama and the back and forth and the territorialism. That is also not conducive to healthy outcomes. So we work
Mhm.
in trying to be very collaborative in our work, make sure that our families are able to hook up with physicians, hospitals, wherever they want to be or need to be. We consider ourselves the facilitators, the navigators, if you will, of this broken system so that they can at least get through and out the other end whole. So we found that the simplest way to reach that is to always let everybody in the door, always be willing to help everybody, meet people where they are, provide those connections where there's trust. Once there's trust, we can share knowledge and empower each other, both
That's
provider, family, birthing parent, and institutions, and we can all move forward together.
that this is why I'm so excited about our partnership and the work that we're doing together. It's just understanding, the advocacy part of it, right? Because how critical that is, and also making sure that birthing people have the opportunities that they have, and not only again inside of prisons, but also in community, right? Because there are women like myself who were previously incarcerated.
That's
I don't
right.
have children, but I may want to have children. And though thank God I created an organization that offers great health insurance, because I wanted that for myself, that I may want an alternative birthing practice. And people don't often, even with great insurance, will cover that, right? And so, like working with these healthcare providers, like you said, presently our work that Tanya is leading around making sure that we can bill Medicaid in order to allow every single woman an opportunity
Yes.
to have the best health outcome and best childbirth that they can have. So it is just really, really powerful to hear you, and not only all of your passion, but this is why you're a Times Woman of the Year, because you've been doing the work that you've been doing in the way that you have been doing it, and understand the need in all of these institutions. So thank
Mhm.
you again for that.
Yeah.
Halima, as a Black mother impacted by the criminal legal system, you completed the inaugural cohort of our Doula initiative. For you.
Mhm.
Why is it important that doulas come from the communities that are experiencing the most disparities, and that those doulas are being paid a livable wage?
Yes.
Well, It's important for doulas to come from communities with the most disparities because the communities with the most disparities has the longest history of being like sterilized and having their reproductive rights violated for centuries, basically, in terms of being able to trust your community members. You need to be able to trust people within your community. It's hard to go into these medical institutions or into these medical systems alone. It's important to have somebody that knows your history, that knows about you and your culture, your cultural practices, and all of the things. It's important um, for us as birth workers to meet clients or meet the birthing person where they are. And oftentimes when they enter these medical institutions don't meet people where they are. They want people to meet the medical institutions where they're at. So they want to bring people up to their level and their understanding. And oftentimes people from our communities or from impacted communities don't have that level of understanding, and they're coming from traumatic backgrounds. And then they're oftentimes going into a space that has a history of causing trauma to these people and these communities. And so it's important for them to have somebody from their community to help them navigate the woes and the hoops of fire that they have to go through when they enter these spaces. I think that it's important to pay doulas livable wages because everybody needs a livable wage. Everybody needs to be able to live. Oftentimes, doulas are leaving their own families to be at the bedside of other people. We're oftentimes on call 24 hours, 7 days a week. And we need to be able to take care of ourselves. How are we supposed to give people the best and the best type of care and service if we can't even take care of ourselves? There's like this expectancy for us to pour from empty cups. It's like they want us to fail, like it's a setup for failure. However, we are resilient. We have proven to be resilient. But why do we have to even be resilient in this field? It's like we're here to empower.
Mhm.
So we should be empowered too. We should be empowered with funds to take care of ourselves.
No, you're absolutely right. When you think about when you were talking about the wages, it had me think about a sister whose both of her parents have are presently incarcerated. I had a conversation with her yesterday, and some of the work we're doing was scaling into Maryland, and she said to me, well, Topeka, she's a teacher. And she said, I understand that you're coming to Maryland. I'm looking to move there. Do you have any openings? I said, well, send me your resume. Now, the child had a double degree, undergrad, and then a master's degree. And she's like, yeah, as a teacher, I'm only getting paid $50,000. And I was like, wait, what? Right? Like, here's, a young Black woman who is a teacher for, I believe it's elementary school, right? Where children are most impressionable and need great educators, but she's only getting paid $50,000 a year. And so it started having me think about even, this work, right? It's like, so
Mhm,
many people will fight about what is the right wage for a birth worker. How much do you pay? What do you ask Medicaid and Medicare to be able to bill up to? I mean, I would, leave that question up to anybody who's also, who wants to answer that. Like, what should you be being paid? Because there is not necessarily a standard, right? Like, there has not been a standard. And I hear so many things. And then, so I want an answer to that question, but also there was also a question I put in the chat. You mentioned about past trauma. And so
mhm.
the question is like, how does past trauma affect healthy birth outcomes? So that's for anyone to answer either of those questions.
So for women, I am convinced that the trauma that we experience, the pain and all of the suffering that we experience, we hold that in our wombs. We hold that in our womb spaces, and it shows up as like fibroids and things of that nature, like all of endometriosis and all of the issues and woes that Black women that is prevalent in Black women. I swear that I am convinced that these things, like all of the heartaches and all of the things that we experience, that having to navigate anti-Blackness, having to navigate being a woman, just having to navigate all of the things that we navigate and how painful that is, we hold that in our womb spaces. And because trauma impacts the way our ability to like dream and be able to speak up for ourselves, oftentimes people's voices are stolen
Yes.
by trauma. And so once they get into these medical institutions and that trauma is triggered again, their voices become silenced again. And it's like it's important to have somebody there that can amplify your voice, a doula or a support person that can amplify and knows what your birth plan is, and they can speak up for you when you are in a moment. Like if you get triggered in that moment and you can't speak, you have somebody there to speak up for you. And I think the living wage, or a wage that would be decent right now, would probably be $1,500 per birth minimum. And I don't know if anybody
Yeah, I
else
was gonna
has
say,
any
what do you
comments
think,
on
Well,
that.
Jenny?
I was going to talk just about the trauma, because our bodies hold memories even from your own birth. You know, cycles have a way of repeating themselves, and so being able to work through that can help greatly. And even if you are a birth worker, you have to work through your own and thinking about your own birth, how you came to this world, because you repeat things when you interact with somebody. You can have your own trauma that can be woken up again from working with someone. And so it's important to be able to work through all of that even before you start to do this work. So
Yeah, that's so true. And does either of you want to talk about wages? Like
Oh,
what would
yes.
be
Don't
that's
start me
great.
off, but look, that we started out with racism. Why do you
yeah.
think Medicaid pays so poorly?
Mhm.
Because racism, because it's been established that you can charge a certain amount of money for procedures for one type of person, but an exorbitant amount of money for another type. Every insurance, commercial
Mhm.
insurance, is set against Medicaid. So Medicaid comes in low, stays low, and then the commercial can be sky high and ridiculous, and that creates the divide that has the treatment that you receive differ. The practitioners are affronted, upset, annoyed, frustrated, including me, because you cannot make it on Medicaid. Medicaid doesn't allow you to sustain your work. So you're right. We need to have this conversation about how much should a birth worker earn? What is equitable? When we talk about economic justice, that's where we need to really start. But then we also have to look at why we have agreed with this wretched system that segregates the providers and causes the providers who can afford to maintain their practices with Medicaid to stop taking Medicaid, and thereby again create another barrier to care or quality of care. Because
Yes.
even inside of the hospital institutions, you will notice a patient that has Medicaid gets a different type of service than a patient who has commercial.
Yep.
That's why I bring this back to racism. The underlying injustice shows up that way because
Absolutely.
we've agreed that that's how the system is going to remain. And that's how they perpetuate these outrageous price points that are just, none of them hardly have any relationship to what's actually getting done.
That's
Look at
right.
pharmaceuticals, big pharma. All of this plays into why Medicaid is wretched and doesn't pay us what we need and what we're worth, as well as we've also created other silos where inside of our different disciplines, we are fighting in that same place of, well, your qualification is not as adequate or is not as strong, or I've done many more years, or I deserve. All of this infighting
Yes.
is on purpose. And thereby the
Mhm.
clients, the families, the communities suffer.
That's right.
in movement spaces in general, the fighting between in those spaces between the people in those spaces, it's on
Yes,
purpose. The confusion is on purpose so that we don't keep our eyes on the
thank you.
prize because we're too busy fighting over
Yes,
pennies.
divide and conquer.
That's right. And it
Divide and
works.
conquer.
Yeah.
It
Exactly.
works.
Every single time. Throughout history, though.
Which is why it
You would
can
think we would have learned.
absolutely. But I still haven't heard the what is the where? What is the equity on the wage? Right?
Oh,
Like
the
I heard
amount?
yeah. What
It
would you
depends
say?
because we're not just talking about one day doing a delivery, in the labor and delivery room and rubbing backs and double hip squeezes. We're talking about a continuum of care. We're
That's
talking
right.
about before pregnancy, if we can even get that much achieved, what a blessing if we could. During the pregnancy, the labor and delivery, but the postpartum. Now we have this recognition that postpartum goes out a full year. Oh, about time. Well, hello. Meantime, who do they think is going to be the provider, the workforce, to deliver this postpartum care that Medicaid now wants to pay for?
Mm,
So we have a continuum of care. So how do you price that out? There
mhm,
isn't one finite point in the childbearing spectrum and
mm,
between children where a
mm,
doula, a childbirth educator, a lactation supporter, a midwife, a physician is needed. There
mm.
is no price point, right? I think in our state, I'm in Florida, I can bill for a midwife visit and I might get $40 from one of the Medicaid plans. But if I were able to bill as a doula, which I still can't achieve, but somehow the doula fee schedule is $100 for the same visit. So
Wow.
that's great for the doula, but it's also like, hello, what happened to the midwife? $40 for the midwife? $100 for the doula. Yay, we're on the right track with that $100 for the doula, but something else is wrong. Something
Yes.
is really out of whack.
Wow.
Yeah.
And it goes back to racism, right? It goes
I
back to
believe.
these systemic issues.
Yes.
Well, we got to work on that. While we look at different policies and different legislation that we
Yes.
look to pass and work, even now they're talking about within prisons, how are people able to get Medicaid and Medicare or while they're incarcerated, before they actually are released. And the question is, people are like, let's do it 30 days. I'm like, 30 days, that's ridiculous. It needs to be at least a year, right? Because all the things that people need to do to
Yes.
set up their service, to find a healthcare provider, they should be able to have an opportunity to communicate with that healthcare provider before them. And then when you think about, to your point, people who are presently incarcerated and pregnant, how are we talking about, prenatal care, during the lactation, postpartum, like all of that, and what is the right wage? So, this definitely is a deeper conversation for us to, continue to move forward and have. And so as we move on to like just again, I think this is a great way to move into addressing the maternal health crisis. Mary, if you can explain how birth workers serve as advocates along the prenatal continuum, share information about the maternal health crisis, and detail the way that the Doula Initiative will create pathways to economic empowerment for women who are presently and previously incarcerated.
All right. Well, I want to say thank you for this opportunity. And I have a quote that I want to share because I think that birth workers and perinatal educators, they provide a grand service to our community. And so birth is an opportunity to transcend, to rise above what we are accustomed to, reach deeper inside ourselves than we are familiar with, and to see not only what we are truly made of, but the strength we can access in and through birth. And so I think that that's the work of the birth worker. That is the person that reaches out, meets somebody for the first time, and has a bond that they create with that person, with that family. And so it is the family. It's not just the birthing person. It's being able to talk to everybody who's involved with the birth, who might be in the household, and talking with them just about that birth and being able to support all those people. And so creating this birthing team that not necessarily saying everybody has to be at the birth, but the birth lasts for a period of time. And so really working with everybody around that, because everybody's birthing something when it comes to a birth. And so everybody is learning, everybody is supporting, everybody affects how that baby comes here. And so birth workers support people, and they are advocates through the whole birthing process, from going to appointments with the birthing person, to showing up at the hospital at 2 o'clock in the morning, or even just answering that phone at 2 o'clock in the morning and having to sound like that you wasn't in a deep sleep, and so that you're there, you're waiting, you're ready to serve. Now
Fantastic.
you asked me a couple other questions in there too.
Yeah. And so I mean, you spoke a little bit about what the use of the word birth worker, but for the viewers that are listening, can you explain what a birth worker is? How did you decide to become a birth worker? And how can birth workers combat the maternal health crisis?
Hmm. Well, a birth worker is someone who provides emotional support and general care and advice to the birthing family, birthing person, and so during pregnancy, childbirth, and beyond. And so that's the work that they love. That's the work that they do, and it's a calling, just as midwifery is. It's a calling, and that's basically even how I got into the work, because I when I got out of college, I really wasn't sure what I wanted to do, and so I worked for a parenting organization, and I ran teen mom parenting groups, and I found people who had been teen moms themselves previously, and they were volunteers, and I found those people, and they ran my groups, and so I kind of helped facilitate that process. And just one of my moms was had a birth. She already had a child, and she was pregnant with another one, and she didn't want her family there to support her. She said because they performed previously, at the birth, her family caused a ruckus at the hospital. And I told her that, well, I'd never seen a birth. I didn't have any children at the time. And I said, but I know you shouldn't go by yourself. I said, I'll go with you. And that's all she wrote. That was back in the late 80s. I went to this birth, and I fell in love with the whole process. And the labor and delivery nurse that happened to be hers at that time said I was a wonderful doula. And I was like, a doula? What is that? And she told me what it was, and I said, oh, okay. I said, I was just doing what I do, you know. And I went through a training at that point in time, and that was it. And so it's a calling. I found out that my great grandmother was a granny midwife, which I had no idea. My father just kind of told me on the fly, oh, I was born at home. My grandmother birthed me. She birthed people in the community. I was like, Dad, do you know what I did? You know what I do? And I said, so I truly believe that it's a calling, and I think that the work that we do makes an impact on the community just in general. We are community health workers. We are birth workers. We are support people. We are parental guides. So we provide a lot for our communities. And at this point in time, just because it isn't reimbursed, a lot of people just do it for the love of it.
Well, that's got to change. So, we work on all that, know that much. That's why I'm asking these questions, because I'm not the expert on how much people need to be paid, but I do know they need to be paid and paid really, really great for this work. Because to your point, you are bringing in healthy babies, you're creating healthy families, you're healing trauma. There's so much that you're doing through this work. I think it is beautiful. And I remember we created this program because there are dual initiatives. When I first came home, we worked with a group of women nationally on legislation around ending shackling of women during child labor. And so while we tried to pass it on the federal level first, it didn't work. And so I began working with Cut 50 at the time as a director for Dignity. And we end up passing about 18 pieces of legislation nationally with women who had been directly impacted and had been incarcerated before, who actually led the passing of the legislation in their states. And so through that, understanding the unique need, we're going back again to those who were directly affected by these systems, how that actually impacts why things move and they change. That on that journey, I remember going to, I believe it was Michigan, and I met Doula, the prison doula program in Michigan. And we had organized a bunch of people and they were there. And I was like, oh, they started talking about the work that they do. And I'm like, this is great. But I didn't see any Black women. And I was like, oh, okay. So we have, white women going into the prison to help deliver Black babies, which is great. We need the support. But where are those people that look like me? Right. And then it was like, well, wait a minute. We don't have any, women who have been directly affected in that system helping women who were pregnant. And while, so, time had gone on and the opportunity came with Optum through one of our board members, Faith Leach, who connected us to Optum. And they were like, are you doing any work around this? And so I explained, I had wrote up a proposal many moons ago. That's why I'm like, God always says, write the vision down and make it plain. At the appointed time, it'll come to pass and it will not tarry. And it didn't. And so they ended up funding our first cohort, and then United Healthcare's extension decided to continue to work with us there. But with that, we definitely needed to have women who have lived that experience to help other women who are living through that trauma in order to help with birth, with delivery, right? Because we need to relate, we need to trust. And I know when I go into prisons around the country and they see me in my heels and they're like, who's this woman coming here? And I was like, oh, well, I was where you were. They're like, wait a minute. And then they open up and then they speak differently and then they feel connected, right? So it has been really, really impactful. And so either you or Akmary or Jenny, can you tell us a little bit why the unique aspects or what the unique aspects are about our partnership between the LOHM and Common Sense Childbirth?
Wow. Well, yes, look, straight away, I mean, we knew, because this is an area where we have not made many inroads on our own as of yet, other than when clients come to us who are pregnant already and have been released from incarceration, from the carceral system. What we knew immediately was, here's an opportunity to do exactly what you just said, Topeka. The lived experience piece is the only piece authentically that immediately removes the distrust, the fear, the angst. We know that when people work with people that they can relate to, that they feel safe enough to disclose, to ask, to communicate even, and thereby their outcome is immediately improved. We have no other reason why we have these outcomes. It can only be that, because we don't have fancy obstetric wizardry. We don't have a whole bunch of money. We don't have, more staff than we know what to do with. Yet our babies are full term, our mothers and families are thriving, breastfeeding, etc. So we saw this as an opportunity to be able to do what we do, but with folk who truly have that lived experience. And so that would be, a better way to convey the information, the training, and to provide the support. But also we knew from the other side, the economic justice side, that with the good support and the solid foundation, we can help people create and maintain sustainable practices. So there's a workforce development piece married in there too. So for us, it just was like a slam dunk. It makes perfect sense to work with an organization such as LOM, because we now have an opportunity to do two things at once. Get the support on the ground where we need it, delivered by people who can truly do it safely and adequately, but also increase the opportunities for them in terms of workforce development, economics, and, feeling that they can get back into the community, get back into society, and have a tangible professional way to do that.
And I think also being able to talk about culture, because we do talk about culture in our classes, and what knowing your own culture, what that does to your connection with yourself and with your baby, being able to share that with your family and to bring your child up in their cultural heritage.
That's right.
Well, yeah, it has been transformative and continues to be, which is why I'm just so excited for us to be able to offer the opportunity to women who are presently incarcerated. I'm not, again, I said early on that I do not believe that babies should be in jail. Although there are nurseries in prisons, I don't believe that should happen, period. However, as there are much effort in decarceration, abolition, and other things, that while people are working on that aspect of it, we also need to make sure that these conditions of confinement are more humane while we're looking to change these systems or abolish them. And
Mhm.
so it is critically important if we're going to have mothers in prison, the pregnant people in prison, that we need to make sure that they're getting the best care that they can. And it has to come from those of us who've been there. And then it also offers that opportunity for people who may have been in the health industry, who want to get back in that industry, that this is an opportunity for them to do that, right?
Yes.
There are no necessary hindrances or barriers for birth workers, whether they've had a conviction or not. And like everything else, if there becomes one, we advocate against it. But I think that, for this, it's like about how we're moving these policies also, right? So I think moving forward, like what would you suggest are some of the policies that can be worked on now to make some real change in the maternal health care crisis? And that's for all of you.
Hmm.
I was just going to say I'm actually going to be um, doing another panel tomorrow night for the film screening Belly of the Beast. And
Yes.
Hmm.
that's talking about, the forced sterilization of California prisoners and like how they're still like they're working on getting reparations for those folks now, which brings me to my point. I think the way that we are going to get justice for like in maternal health care or like get equity or any of the things that we're asking for is by hitting folks in their pockets and starting to ask for reparations for all of the damages that have been done already. And folks seem to be scared to ask for reparations because it's like, oh, well, for whatever reasons. But I think that we need to start asking, and well, not asking, but demanding reparations for all of the racism that we encounter and we have been encountering when dealing with systems in this country.
Yep.
Hmm.
Yeah, I would add, there's some legislation that has been ongoing over the last couple of years called Momnibus. The Momnibus package is a very robust set of bills. I think there are 12 in the entire package.
Mhm.
And it started as a federal initiative in Congress. Representative Lauren Underwood, a very dynamic young sister. She's a nurse by trade, but she's now representative, and she and Representative Alma Adams together formed a bipartisan caucus called the Black Maternal Health Caucus, and they have been working very hard. The bill itself has many components. Most important for me, at least, is the workforce development piece. I was able to work on the advisory committee for these bills, and I'm very keen, as you might know, to work on workforce development. So that was one of the Perinatal Workforce Act. There's an act there that deals with some of the things we're talking about. But the technology, the paid leave for mothers and families, they brought COVID into that bill, of course. Um, the community-based organizations being supported, the
Mm.
ability for families, military families, I think we were very thorough going out throughout that bill. Now, it's federal legislation. It has gotten lost inside of the Build Back Better, and it's stuck in the Senate. It passed the House, but it's stuck. And who knows when it's coming out of that, or if it can come out, if it's underneath of the Build Back Better current legislation. But everything that's in there could be replicated in every state. Each state could have its own momnibus. I think should have its own momnibus, because
Hmm.
they are all bills and policies that put Black and Native women front and center. And this is the first, obviously, where there's ever been this much work and this much attention to the needs of Black people. So I think that's a start. We're on our way. But with any policy, we can write all day, we can pass all day. What trickles down to reality on the ground,
Mhm.
not always the same thing. So
Right.
our advocacy work needs to be really organized. Excuse me. And we need to be ready when it comes time to bring these. Oh, goodness, let me stop talking. Sorry.
Mhm.
Mhm.
Yeah, people people need to think about the advocacy piece, and so really reaching out and talking to legislators. I know people don't like to do that, but it can make a difference if you make enough noise. It can make a difference, and so I know that there's many states at this point in time that are trying to put together different kind of policies that can make a difference. And so it's about people finding out what those are in their own area, knowing their own legislative person, and making sure that person knows you and that you live in their district, and that you have a lot of friends who can make it real uncomfortable for them if they don't listen to what you have to say.
Yeah, we do need to continue to apply the pressure. That makes me think in 2017, I was part of the lead organizing group that led a rally around getting Medicaid reimbursement for doulas.
Hmm.
And yeah, that was in 2017. And what was interesting about that is we organized, we planned the rally, and like 25 people came out. It was on a Saturday at the hospital. If 25 people came out, that was a lot of people. But the very next day, on a Sunday, they held the King Stop Killing Kings rally,
Hmm.
and it was like hundreds of people that attended that rally. And nobody, well, not nobody, but the little bit of people that we had at our rally, it was just a stark reminder to me that we have to do a lot more organizing in
Yes,
different spaces, and we need to and collaborate with different orgs and different people to get our message across so that we have more people on our side and
yes,
willing to fight for us and call legislators for us, because us just calling legislators is not enough. We need the families that we support
That's
to
right.
call the legislators. We need their families to call these legislators for us so that we can continue our work.
that's
It's
right.
going to take a combined effort.
And I think
And that is definitely something that has to happen, or no change will come about. So it's
And I think
definitely true.
we looking at it from the angle of our responsibility to lead that, because when we look at these statistics, and they barely change from one year to the next, although they have been worsening over the last couple of decades. We If we don't do these grassroots things, we won't get any real traction. We won't get any real change. So it's another additional thing to do on top of what we're already doing,
Hmm.
but
Yep.
it is so key. And I've got a dear colleague, Paola Rojas in Austin, Texas, who is a brilliant organizer. And she led over I don't know how long ago now, but many years, using the moms and the families that they served in their area for birth work. They walked and they marched and they pushed their strollers, and they managed to get the city of Austin to fund families out of the police budget because of
That's what we need
safety
to do.
issue, right?
Yes.
So it's about just having that organizing spirit, staying the course, and recognizing our responsibility. Yeah, I'm a midwife. I love catching babies. Great. But I also have to do this piece. You can't do one without the other.
Yeah.
The
Mhm.
doulas, the birth workers, the childbirth educators, everybody recognizing the 1-2 punch of organizing so we can maintain our advocacy work, education work on this other front. The 1-2 punch, I think that's the most effective way to bring
Yes.
about change.
Yes. Definitely. Definitely.
Right.
So powerful. So while we are in our closing remarks time, I want to give each of you a last thought for you to share any suggestions for how people can make a difference based on the work that all of you have done in your respective areas. So each of you are working in this space, but what suggestion would you give to where people can tune or tap in, right? For me, I heard a lot around advocacy around fair wages, equitable wages. I shouldn't say fair because fair is also relative. Equitable wages for people and ending discriminatory practices within the healthcare industry as a whole. But what would some of you all also lend as in some perspective?
I'll jump in. I would say this is a real opportunity. Now that we've shared this information, keep sharing the information. You don't have to be out on a soapbox on the street corner. Talk to your family members, because we always have somebody who is either pre-childbearing, in childbearing, just had a baby. Make sure your own family, your own people are okay, but also what happened to them. And then also share this information with them, because it is about awareness. And so we start small. Don't get crazy. Don't overwhelm yourself. Don't fall apart and leave. We need you. But you don't have to be the provider. You don't have to be the one who's doing the heavy lift, but just check in. Check in with yourself, check in with your family, check in with your people. Talk about this as an issue, because this is an issue. And I think the simplest thing to do is get started.
Mm-hmm. I want to echo Jenny with the get started, with talking with your family members about your birth stories or your family's birth stories, and like getting to know what the family's history is in terms of like what birthing, having babies. Like Akmiri said, her dad just said in passing that her granny was a granny midwife. It's like that should not be. Those should be parts of regular conversations.
Right.
You know what I'm saying? So just get started having conversations, being more transparent with each other and our families, and that's what I have to say. Get started.
Mhm. And I want to say, if you have gotten started, don't stop. We are losing too many birth workers, doulas, birth attendants. People get either tired or they get mad at somebody and they leave. We need you. So find somebody that can mentor you, find another person who's doing the work and being able to talk, because we have to have a community of workers who don't get mad at somebody and stop doing this. You're needed. Our families need you. And so get the kind of support you need. Maybe if you just had a baby, maybe it's not time to be a birth worker yet.
That's right.
Let your baby get a little bit older before you start doing the work. I talk to people about that in training. This is an opportunity to see if this is something that you want to do. It's life work. It's
Like
life work. And so don't leave. Find somebody who you can have be your mentor.
I
Um,
found a whole community of mentors, and I'm so grateful for them.
Yes.
just do it. Don't stop. Keep moving. But all of this just sounds to me like continue to press forward and
Yes.
know when you're being called to do something, which I think we all have been. Everyone who is in this space in this work, when you're called to do a particular thing, that you move in your spirit, and the outcomes that come from that is just you can't quantify it really. But we will, right? We will make sure that we are quantifying it with real dollars and real equity, because I think that the work that you all are doing is incredible. I mean, when I think about doctors, they go through school, and yet it's the nurses that are the ones that are actually doing all the work and not getting paid in the way that they are. It's like the
Right.
same, right? It's that dynamic, that hierarchy, which again leads to white supremacy, right? And so as we continue to build out this particular program, I urge any person who has been directly affected by the system or any of these institutions, as have been mentioned, please sign up. We're going to have four cohorts this year, potentially more. We're going to continue to move forward to build this globally, and also within prisons. I've been talking to sisters who are also looking to do houses that specifically help to focus women who are, within their childbirth. And so, how can we do that as ways to divert people from going to prison, as alternatives to incarceration? And there's so many different ways to plug in. But, as always, Please continue to support the work of the Ladies of Hope Ministries. You can text to donate, or just to stay involved so you know what type of programs we're doing, and also to keep, building with us and building our community. So the text to donate number is THELOHM 2022 for 2022, and you text to the number 41444. Please go to the website, thelohm.org, just so you can stay involved. Please sign up for any number of our programs, but this program specifically, because I think not only would it help you, right, as it relates to your own healing journey and how you're even thinking about birth work, but also it will create an equitable opportunity that we are going to make sure that you are compensated in the way that you need to. So I would like to thank our wonderful panelists, Jenny, Halima, and Akmeri, for your time in this National Doula Week to join with us and our community. I thank God for all of you, and for, Halima, you entrusting the organization in the first cohort, for Jenny and Akmeri, you entrusting the organization to partner with us in order to continue to build this opportunity and work for other sisters. And so I am grateful for each and every one of you. Thank you for people who joined in to view and to learn and to share your thoughts. Please join the movement. And anyone who has any, real influence on, any policies, any legislation, any ideas around things that we can do in order not only to focus politically on things, but also within these corporations, within these healthcare systems, within the providers, within the hospitals, within the community. Because that's also necessary in how we're advancing the support and the maternal health outcomes for Black and Brown people. So I love you all. Blessings to all you. God bless you, and have a great evening. Thank you.
Thank you.